Hello, everyone. I am Dr. Supriyo Saha. I am a consultant physician specializing in geriatric medicine and I practice in Kolkata. A lot of my patients suffer from heartburn, especially during nights, often after heavy meals, and especially common people who are obese, people are sedentary, people who are fond of eating a lot. Heartburn is characterized by an uncomfortable burning sensation in the chest. This is a very common complaint in OPD. It is usually associated with diet. This is not the case in all cases. This may signify a spectrum of disorders which is called as acid peptic disorders. Heartburn often stems from acid reflux. What happens when we eat food, the stomach secretes hydrochloric acid. This is very acidic. The pH often reaches 1, and this acid is used to activate the enzymes which will digest the food. Now, if there is more acid secretion, then what happens is that there is movement of this acid upwards into the esophagus or food pipe and may even reach the throat. This acid content irritates the esophageal lining, leading to the burning sensation, which we associate with heartburn. Occasional acid reflux is normal, but frequent episodes is a sign of gastric disorders such as GERD. What happens is this extra acid, which is secreted in the stomach, often moves up, especially when you are lying down after a heavy meal. The acid will move up. Sometimes it may come to your throat. Sometimes even it may come to your nose. And as I told you, this acid corrode, this is very acidic. This will corrode the inner lining of the esophagus, that is the food pipe, and even the throat. And people suffer from a burning sensation, which often persists as long as 24 hours after the episode of reflux. So this disorder, very painful, depletes your quality of life, depletes your sleep, and often people suffer the next day of the episode. GERD is a common digestive disorder affecting millions worldwide. And of this, heartburn is the most common symptom of GERD. Other GERD symptoms are also there, where there is regurgitation of food into the mouth. There may be acid taste in the mouth. There may be severe chest pain. And often this chest pain may mimic a heart attack. So if you are having a chest pain, do not think it is always due to GERD. The chest pain can be due to a heart attack, can be due to other disorders involving the heart, and should not be confused with GERD, though GERD patients make up a substantial number of patients who complain of chest pain. But if you are having a chest pain, it may be a serious life-threatening emergency. You have to take immediate medical attention. If your doctor is unavailable, because often this happens in the middle of the night, please do visit any hospital emergency, because pain from GERD and pain from heart attack sometimes become undifferentiable even to seasoned clinicians. A battery of tests are usually done to rule out heart disorders before as GERD. Therefore, if you are having a problem of heartburn, it may be GERD, but may also be cardiac disorders. So, other symptoms apart from chest pain is dysphagia. What is dysphagia? Dysphagia is difficulty in swallowing. What happens is this acid corrodes the inner lining of the food tube, or sometimes even the inner lining of the oral cavity. And whenever the person swallows, he may feel a sharp pain, because this damaged epithelial tissue often gets secondarily infected. So, summing up, GERD may cause heartburn, that is the most common symptom. Often there may be regurgitation of food into your mouth, especially when you are sleeping. There may be acid taste in your mouth, there may be chest pain, and there may be difficulty of swallowing. Acid peptic disorders actually encompass a group of conditions where it is the body's own acid secretion and enzyme secretion, pepsin enzyme, they damage the lining of the upper GI tract. That is the inner lining of the stomach, the esophagus, and even the duodenum, leading to peptic ulcers. Peptic ulcers is the most common type of acid peptic disorder, and that too can cause severe abdominal pain, pain in the chest, and also vomiting, anorexia, and a sense of perpetual weakness with weight loss. Heartburn and acid peptic disorders are often correlated with a bacteria called Helicobacter pylori. Now, this is a bacteria which loves acid, which thrives in pH as low as 1, that is in very acidic medium. And Helicobacter pylori is often the cause of acid peptic disorders. The only way we can demonstrate the presence of Helicobacter pylori is if we do a endoscopy and we do some urease tests on the endoscopic lavage or the tissue taken from the stomach. So if Helicobacter pylori is present, we have to treat this bacterial infection, which will ultimately result in lowering of acid secretion and improvement in the symptoms such as heartburn in patients of GERD. So if your heartburn is persistent, if it is not getting cured easily, and if the doctor advises you upper GI endoscopy, please don't shy away from it. It is not, I repeat, it is not a painful procedure. Nowadays, we have flexible fiber optic endoscopes whose diameter is not much and that can be easily swallowed, and it will give you, your physician, a picture of your esophagus, of your stomach up to the duodenum. We can collect biopsy samples, we can do tests to exclude Helicobacter pylori. And this will eventually make your treatment pinpointed and 100% successful. So please do not refrain from undergoing upper GI endoscopy if advised by your physician. Seeking prompt medical advice is advocated in the event of frequent heartburn. And if the heartburn is very acute, please rush to the emergency, exclude cardiac disorders, exclude a heart attack. Remember, early diagnosis and treatment is always better. And here, in this case, early diagnosis and treatment of GERD and peptic ulcers can prevent complications and will improve your quality of life. Heartburn, if detected from peptic ulcers, is very easily treatable with oral medications. And usually, most people improve and get cured within 6 weeks. So, this is a curable disease. And if you are having recurrent problems, do visit your doctor. Your physician will guide you regarding the appropriate lifestyle modification. That is, the appropriate dietary changes you need to take. One of the most important changes is avoid fat-rich food at night. The dinner quantity should be reduced and have an early dinner at least 2 to 3 hours before you go to sleep. This will ensure that the food which has been gone into the stomach is digested well and goes into the small intestine before you lie down. So once you are lying down, if there is no food in the stomach, usually the acid secretion will also cease and you will not have any problems of heartburn. So lifestyle changes are very important, and along with lifestyle changes, the doctor will advise you medicines which we call as pharmacotherapy, and that will aid in reversing your heartburn symptoms. Remember, this is a curable disease. If it is creating problems in your daily life, if you cannot sleep well due to heartburn, do consult your physician as early as possible. Thank you for listening. I am Dr. Supriyo Saha, consultant physician and specializing in geriatric medicine. You can consult me in Kolkata. You can Google my name and you will get into my website. Thank you.